How are you guys? My name is Mitch McIntosh, and I'm going to be talking about the effects of globalization on healthcare provision. All right, let's get her started here. Some of the main topics I'm going to be talking about here are the effects of globalization on disaster preparedness, medical tourism, and global healthcare economics. So, we're going to be starting out here with the effects of globalization on disaster preparedness. And basically, disaster preparedness refers to the ability of organizations or states to effectively combat a disaster before it gets to uncontrollable proportions. Essentially, this requires multilateral cooperation between concerned organizations and countries so as to effectively address the unforeseen catastrophe. Um, Importantly, though, in order to achieve this goal, the global countries must share technology, information, resources, expertise, and finances. Nevertheless, there are factors that hinder multilateral associations, such as the differences in GDP levels among countries, the lack of political goodwill, and inequalities in distribution of resources. For these reasons, developed countries may be unwilling to associate with developing nations because of the perceived limitations, so to speak, on the part of the poor states. However, the West African Ebola outbreak presented important lessons on the need for the establishment of global approaches in disaster preparedness programs. Furthermore, with the outbreak of Ebola and other harmful diseases that have the potential to spread within a few days, will hinder the healthcare worker, exposing them to all sorts of different kinds of issues that may arise in their future, and further causing spread, etc. So, with that being said, I have a little picture here on the bottom. Basically, just shows all of the entities that have to do with globalization. So we got, let's see here, we got accountability, terrorism, obviously disease, as I mentioned, environment, poverty, growth, and however many more. Okay, let's move on to the next slide here. So we got medical tourism. Um, so let's start out here. Essentially, conventional tourism entails visiting another country to sightsee, to have fun, for education, cultural discovery, you name it. However, an emerging global tourist attraction activity is actually the healthcare sector. Sorry. Notably, there are more countries such as India and Cuba which are revered in regards to the provision of affordable quality healthcare and pharmaceutical products. Presently, these countries also earn foreign income from this emerging form of tourist attraction. And I have a little picture here that shows like from 1 to 14 which countries make the most money, which countries, let's see here, which countries are making the most foreign money off of the healthcare system. And you can see Turkey's number 14 as they are the most war-stricken country, and they do require a lot of healthcare and people to go over there and help out with healthcare. All right, moving along here. Global healthcare economics is our next slide. And we are going to be talking about quality of care, which is dependent on countries' resources or the individual. So basically, what that means, the quality of care depends on how much that individual wants to help that person or um, the country's resources. So in Africa, you're not going to have that many resources, and they actually have an issue with that, as I'll be talking about later on. Let's see here. So, although healthcare is a basic human right, the level of quality applicable depends on the individuals, as I said, or the resources which countries have. For this reason, the developing nations in sub Saharan Africa are recorded to have the lowest quality healthcare services. So, as I said, more impoverished country, lower healthcare quality, and less resources. Moreover, the majority of the poverty-stricken countries rely on donor funds to manage communicable diseases such as HIV, tuberculosis, and malaria. And essentially, without these global efforts, many patients in the poor states that rely on donor drugs and nutrition would probably perish. Notably, the United Nations, however, are going through uh, projects and awareness initiatives in order to improve the living standards of people in the poverty stricken regions. So there is going to be less deaths. As we've seen over the years, there is statistics to support that fact. Um, let's move on here. Just one second. All right. So we're moving into our conclusion. All right, that sums it up. Over the years, the world has increasingly become more interconnected. As people advance in terms of trade as well as technology, they do tend to interact more frequently. With more interaction comes the challenge of managing global disease outbreaks. And not only that, calamities of global magnitude are even more common. For instance, the case of the Malaysian airline, which went missing. It's a perfect example of a disaster in one part of the world that can spell doom on global scale. In the plane, people from different countries were affected, and more on that. There, anytime there is an issue, just I'm just iterating on what I said there. Anytime there is an issue in the world, it is going to be global, especially with media the way it is, technology, how closely interconnected everyone is. We are all going to be hearing about it. There will be global chaos. Okay, moving along to the next slide here is conclusion continued. At present, it is undeniable that healthcare provision should be a global effort. Essentially, in healthcare provision, the efforts would involve cooperation through research and technology in identifying lasting solutions to likely problems. And it should be noted that the negative impacts of disasters are experienced globally, as I said, even by countries not directly affected. Therefore, a concerted effort towards addressing any calamities would be advised. Um, Moreover, when a disease starts from one part of the world, it is possible that it might be spread across the globe very fast. So, again, disaster preparedness will be prepared for that, and that'll be eradicated quickly. The vulnerability of the global population was exposed during the swine flu outbreak, to have an example. And these are just some of the few incidences which should justify why the world needs a joint effort when it comes to the provision of healthcare. All right, so that is my presentation. I hope you liked it. I hope it didn't bore you too much. Uh, I'll get on to my references here. There's all my references in case you want to know. Just copy and paste and you'll find it. All right, thank you and have yourselves a good night.